Hi, my name is Debbie, and I'm one of the block nurses here at TOSC, and I would like to explain to you the catheter and this pain pump. The purpose of this is for pain management. Most people are getting at least 2 to 3 days with this pain pump. Now this is a sample here that we have of the catheter. It has black or blue lines along the end, and it will have black or blue around the tip of the catheter. You will have this approximately 2 to 3 days. It goes under the skin just a small distance. And when it's time to take it out, you will remove the dressing and just gently pull it out. If you have any difficulties at all, you will need to call anesthesiologist, and we do have a number that you can call 24 hours a day. Now this is a sample of the pain pump when it is totally full, and this is what it looks like when it's empty. It looks like an apple with a core down the middle of it. Now this initial nerve block is going to numb up your arm and your shoulder for several hours, and it is a stronger dosage of the medication. This pain pump is a more dilute dosage of the medication, so it's very important that you take your pain medication along with this pain pump. It will not totally alleviate all of your pain. So when you come out of surgery, we are going to set this, it has a dial with it, we're going to set this at 2 milliliters an hour. It has a black arrow pointing down, and it needs to be exactly on the number. We're going to put this at 2, and the reason we do this is because the initial nerve block is a stronger dosage of the medication, and we want your body to have time to absorb that. So tonight when you go to bed, you're going to turn this dial up to 4 or to 6 milliliters an hour, depending on the anesthesiologist that you have. You will keep this on that position. You can turn that up if you do have increased pain. You can dial that up to 8 or to 10 for a couple of hours, but you do need to return it to the initial dial that it was set on. Realize that this dial does go up to 14, but the higher you dial it up, the quicker it will run out. And we would like for you to maintain this dial at the 4 or 6. Do not return it back down to 2 that it was initially put at when you came out of the operating room. Okay, now don't be alarmed if this catheter does leak, because it is going into such a small space, and of course the higher you dial it up, the more it will leak. And you can reinforce that dressing with a washcloth or gauze, but do not, again, be alarmed if it leaks. It's very important that you take your pain medication as prescribed, and we recommend that you take this pain medication before you go to bed at night, so that you do have that on board in case that initial block does wear off. Okay, now you will get a little black bag like this to carry it in, and it has an adjustable strap. Also with this pain pump, it has a white clamp. You want to be sure that that clamp is open at all times. You might want to check it a couple of times a day to be sure that it is open. Now don't be alarmed. This takes approximately over 24 hours to see a reduction in size in this pain pump. So don't be concerned if the next day if it has not gone down, because it is going at such a small rate. Okay, now when you remove the dressing, again, gently remove the catheter, and if you have any problems, we have a number here of an anesthesiologist that's on call 24 hours a day, as well as a on-cue pump nurse that's on call 24 hours if you have any questions or concerns. And in recovery room here, we will be calling every day as long as you have that catheter until it is removed. Again, just be sure to check this clamp a couple of times during the day and make sure there is no kinking of this tubing. Be very careful with this. The dressing, the anesthesiologist applies the dressing and secures it as well as possible, but be very careful with this when you're carrying this pump around that you don't drop it on the floor. If you have any questions, you can ask the admissions nurse when she comes back in, as well as the post-op nurse, and we will give the handout to the family that can be looking over this if there's any questions afterwards. We wish you a lot of luck with this pain pump.